NHA Medical Assistant Medical Terminology. Question 1. A medical assistant is preparing a patient for a Holter monitor application. Which of the following instructions should the assistant emphasize to the patient? Option A. Take a long, hot bath every evening while wearing the monitor. Option B. Keep a detailed diary of all activities, symptoms, and emotional stressors. Option C. Avoid any physical exercise or movement during the monitoring period. Option D. Disconnect the wires if they become uncomfortable during sleep. The correct answer is option B. Keep a detailed diary of all activities, symptoms, and emotional stressors. A Holter monitor patient should keep a diary of activities, symptoms, and stressors so findings can be correlated with the rhythm recording. The monitor should not be removed for bathing unless specifically instructed. Question 2. In the context of the chain of infection, an open wound, the respiratory tract, or a mucous membrane through which a pathogen enters a new host is known as which of the following? Option A. Reservoir. Option B. Portal of exit. Option C. Portal of entry. Option D. Mode of transmission. The correct answer is option C. Portal of entry. A portal of entry is the route a pathogen uses to enter a susceptible host, such as a wound, mucous membrane, or respiratory tract. A portal of exit is how the pathogen leaves its reservoir. Question 3. Which of the following terms refers to the movement of a limb or body part away from the midline of the body? Option A. Adduction. Option B. Flexion. Option C. Abduction. Option D. Extension. The correct answer is option C. Abduction. Abduction means movement away from the body's midline. Adduction means movement toward the midline. Question 4. A medical assistant is reviewing a prescription that reads, "Take 1 tab PO-QID." How often should the patient take the medication? Option A. Once a day. Option B. Twice a day. Option C. 3 times a day. Option D. 4 times a day. The correct answer is option D. 4 times a day. QID means 4 times a day. PO means by mouth, and tab means tablet. Question 5. A medical assistant is preparing a sterile field for a minor surgical procedure. Which of the following actions constitutes a break in the sterile technique? Option A. Opening the outer wrapper of sterile instruments away from the body first. Option B. Reaching across the established sterile field to grab a bottle of saline solution. Option C. Placing sterile gauze within the 1-inch border of the sterile drape. Option D. Keeping the sterile field in constant, direct line of sight. The correct answer is option B. Reaching across the established sterile field to grab a bottle of saline solution. Reaching across a sterile field contaminates the field because non-sterile clothing or arms may pass over sterile items. The assistant should move around the field rather than reach over it. Question 6. Which of the following body systems is primarily responsible for secreting hormones directly into the bloodstream to regulate processes such as metabolism and growth? Option A. Lymphatic system. Option B. Nervous system. Option C. Endocrine system. Option D. Integumentary system. The correct answer is option C. Endocrine system. The endocrine system secretes hormones directly into the bloodstream to regulate metabolism, growth, reproduction, and other processes. The nervous system communicates mainly through electrical impulses and neurotransmitters. Question 7. Which of the following specific types of immunity results from a patient receiving an immunization or contracting an active infection? Option A. Active artificial immunity. Option B. Passive natural immunity. Option C. Active natural immunity. Option D. Active acquired immunity. The correct answer is option D. Active acquired immunity. Active acquired immunity develops when the patient's own immune system responds to antigen exposure, either through infection or immunization. Passive immunity transfers ready-made antibodies rather than requiring the patient to produce them. Question 8. A medical assistant is preparing to perform a venipuncture on a patient with fragile veins. Which of the following equipment configurations is most appropriate? Option A, 21 gauge needle with a standard vacuum tube system. Option B, 23 gauge winged infusion set, butterfly, with a syringe. Option C, 18 gauge needle with a large vacuum tube. Option D, capillary microtainer tube without a needle. The correct answer is option B. 23 gauge winged infusion set, butterfly, with a syringe. A 23 gauge butterfly with a syringe is appropriate for fragile veins because it allows better control and reduces vein collapse. Large gauge needles and strong vacuum tubes can damage fragile veins. Question 9. A medical assistant is preparing to sterilize instruments using an autoclave. Which of the following parameters is standard for achieving proper steam sterilization? Option A, 121 degrees Celsius 250 degrees Fahrenheit at 15 psi for 30 minutes. Option B, 100 degrees Celsius 212 degrees Fahrenheit at 10 psi for 15 minutes. Option C, 150 degrees Celsius 300 degrees Fahrenheit at 5 psi for 60 minutes. Option D, 80 degrees Celsius 176 degrees Fahrenheit at 20 psi for 45 minutes. The correct answer is option A. 121 degrees Celsius 250 degrees Fahrenheit at 15 psi for 30 minutes. Standard steam sterilization commonly uses 121 C at 15 psi for about 30 minutes, depending on load and device instructions. Lower temperatures or inadequate pressure may fail to sterilize instruments. Question 10. A patient is prescribed an enteric-coated tablet. Which of the following instructions should the medical assistant give to the patient regarding this medication? Option A, crush the tablet completely and mix it with applesauce for easier swallowing. Option B, chew the tablet thoroughly before swallowing to speed up absorption. Option C, swallow the tablet whole and do not crush, chew, or break it. Option D, dissolve the tablet completely in a glass of warm water before drinking. The correct answer is option C. Swallow the tablet whole and do not crush, chew, or break it. Enteric-coated tablets must be swallowed whole so the protective coating can delay dissolution until the proper part of the gastrointestinal tract. Crushing or chewing can irritate the stomach or alter drug release. Question 11. A patient requires a legal document that specifies what medical treatments they want or do not want if they become terminally ill or permanently unconscious. What is this document called? Option A, informed consent form. Option B, durable power of attorney for finance. Option C, living will. Option D, encounter form. The correct answer is option C. Living will. A living will states which treatments a patient wants or refuses if they become terminally ill or permanently unconscious. A financial power of attorney does not direct medical treatment choices. Question 12. A medical assistant is measuring the head circumference of an infant. Where should the assistant place the measuring tape to ensure accuracy? Option A. Just below the eyebrows and around the prominent back part of the skull. Option B. Just above the eyebrows and around the most prominent back part of the skull. Option C, around the neck and chin area. Option D, across the forehead and ending at the earlobes. The correct answer is option B. Just above the eyebrows and around the most prominent back part of the skull. Infant head circumference is measured just above the eyebrows and around the most prominent part of the occiput. This placement captures the largest head circumference consistently. Question 13. Which of the following routes of drug administration provides the fastest systemic therapeutic effect? Option A, oral. Option B, subcutaneous. Option C, intravenous. Option D, transdermal. The correct answer is option C, Intravenous. Intravenous administration delivers medication directly into the bloodstream and produces the fastest systemic effect. Oral and transdermal routes require absorption before systemic action. Question 14. Which of the following sections of the patient's medical history includes information about the health status of the patient's biological parents and siblings? Option A, social history. Option B, past medical history. Option C, chief complaint. Option D, family history. The correct answer is option D. Family history. Family history documents the health status and conditions of biological relatives, including parents and siblings. Social history focuses on lifestyle factors such as occupation, tobacco use, and alcohol use. Question 15. Which of the following forms is used by a medical provider to submit an insurance claim for services rendered in an outpatient clinic setting? Option A, UB04. Option B, CMS 1500. Option C, W2. Option D, to 2501. The correct answer is option B. CMS 1500. The CMS 1500 form is used to submit outpatient professional claims. UB04 forms are used primarily for institutional or facility billing. Question 16. A medical assistant is maintaining inventory of clinical supplies. When stocking new items with an expiration date, where should the assistant place the newest stock? Option A. In the front row for quick access. Option B, behind the older inventory items so older items are used first. Option C. At the bottom of a completely separate cabinet. Option D. In a hazard-labeled container. The correct answer is option B. Behind the older inventory items so older items are used first. New stock should be placed behind older stock so items with earlier expiration dates are used first. This is the first expire, first out inventory principle. Question 17. A medical assistant notes a patient has a history of dyspnea. The assistant should understand that this term translates to which of the following clinical observations? Option A, difficulty swallowing. Option B, rapid breathing. Option C, difficult or painful breathing. Option D, absence of breathing. The correct answer is option C. Difficult or painful breathing. Dyspnea means difficult or painful breathing. Dysphagia means difficulty swallowing, which is a different clinical term. Question 18. Which of the following legal terms describes a situation where a medical professional fails to perform an essential action or performance standard, resulting in direct harm to a patient? Option A, battery. Option B, negligence. Option C, slander. Option D, assault. The correct answer is option B. Negligence. Negligence occurs when a healthcare worker fails to meet the expected standard of care and the failure causes harm. Battery involves unauthorized physical contact, not failure to act. Question 19. A medical assistant notes a provider's order for a medication to be given PRN. How should the assistant interpret this instruction? Option A, immediately. Option B, before meals. Option C, as needed. Option D, by mouth. The correct answer is option C, as needed. PRN means a medication or treatment is given as needed based on symptoms or clinical indication. It does not mean immediately, which is commonly written as STAT. Question 20. Which of the following standard abbreviations stands for a medical order indicating that a patient should not receive cardiopulmonary resuscitation if their breathing or heartbeat stops? Option A, NPO. Option B, DNR. Option C, STAT. Option D, OTC. The correct answer is option B. DNR. DNR means do not resuscitate and indicates that CPR should not be performed if breathing or heartbeat stops. NPO means nothing by mouth.